Hello and welcome to yet another episode of Orthopedics Made Simple, making no bones about it. And today we're going to talk about a condition called tennis elbow. What is tennis elbow? It is basically inflammation of the area around the outer aspect of your elbow, which is known as the common extensor origin. It is called the common extensor origin because all the muscles which help in extending or lifting up your wrist and the fingers originate from there. It is called tennis elbow because it is common among tennis players and other players who play racket sports. And it is not restricted only to those sports. In fact, our very own Sachin Tendulkar had to suffer from this for about 6 months to 1 year. He had to lay off from international cricket. The reason being, he had to use a heavy bat which placed excessive amounts of stress on the extensor muscles, thereby inflaming that area. Now, what do you need to do when you have this tennis elbow? One is rest or restrict activities that aggravate or cause this pain. The second thing is you can go through a course of painkillers which will help to reduce the inflammation also. The third thing, you can visit a physiotherapist who will give you therapy in the form of ultrasound or laser therapy. Some patients are prescribed a splint called the tennis elbow splint, which basically is a tight wrap around the forearm. And the principle of this being, it acts as the pivot from which all the extensor muscles act, thereby giving rest to the inflamed area. Rarely patients will require an injection in the form of steroids, or the other newer principle being used is platelet-rich plasma, wherein the patient's own blood is drawn out, processed and injected around that area to help in tissue repair and reduction of inflammation. Very, very rarely patients go in for surgery. So the key thing to remember about tennis elbow is you need to be very patient, because it is a self-limiting disease which takes some time, and if you're patient, we can avoid doing any unnecessary procedures. That's it for the time being, and my only sign off is always keep moving and keep moving without pain. Thank you and see you in the next episode.